Hello, everyone. My name is Mary, and I am the Program Director for the MAT, Medication Assisted Treatment Program at Lutheran Family Services. And today I'm going to be sharing with you some information about this program. It was recently started in both Lincoln and Fremont, and so we are excited to be able to offer this service. So what is MAT? It's the use of medication in combination with counseling and behavioral therapy to provide a whole patient approach to the treatment of substance use disorders. And in this particular case, we are mainly talking about opioid use disorder. And there are basically three medications that are used to treat opioid dependency, and then one medication that helps with opioid overdose. In treating dependency, there is buprenorphine, methadone, and naltrexone. Lutheran Family Services will mainly be using buprenorphine. The reason for this is because it is the most easily accessible for clients, and it is very effective. At this point, Lutheran Family Services does not plan to use methadone at all, and the reason for that is because methadone requires that individuals come into the office every day, Monday through Saturday, to dose in person. And we don't want to put that kind of burden on our clients, and so we are currently not considering methadone as an option. Naltrexone will be used on occasion. Naltrexone is an injectable medication, and it's important that we start individuals on the pill form of the medication, the buprenorphine, which is commonly referred to as Suboxone. That's one of the brand names, in order to be able to make adjustments before giving an injection that will last a month. In treating overdose, there is naloxone, which is often called Narcan because that's one of the brand names, and we're going to talk about Narcan at the end of this presentation. Who is MAT for? MAT is for use with patients experiencing opioid use disorders, including heroin, fentanyl, and other opioids. Could be that a client has been prescribed OxyContin or hydrocodone and they have become addicted to that prescribed medication. This program will also help with that. In addition, MAT can be used for alcohol use disorder and tobacco use disorder. And MAT has been around for some time because many people have attempted to stop smoking. I've gone to their doctor and said, I'm really struggling. I continually crave the nicotine, and they've been given medication to help them stop craving nicotine. This process is the same idea. People who are experiencing opioid use disorder, if they stop using it, will experience some serious cravings and some pretty serious withdrawal symptoms. So the medication helps with those things. MAT is not for use with any other substances simply because it isn't made to work for other substances. Methadone is often confused for a medication for methamphetamine because they start with the same four letters. Right now, there really isn't an effective medication for methamphetamines. It's being worked on. So at this point, opioids, alcohol, tobacco, that's what medication-assisted treatment will work for. So how does this whole thing help our community? Why do we want to get behind this program? First of all, this program will help with having fewer individuals with opioid, heroin, and fentanyl drug issues. There will be more individuals that are able to go to work every day because they're not dealing with those cravings and those withdrawals. More individuals are then able to provide for themselves and their families and are able to be more productive members of the community. In addition, there will be fewer ER visits or emergency calls because of overdoses. There will be fewer health and medical issues and fewer contacts with or for law enforcement. So in the long run, it saves communities money because those resources are no longer being utilized for individuals experiencing opioid overdose. So what can we as community members do to help? First of all, talk about this program so people know it's available. We are doing community outreach events where we will be talking about this program, but if you know of someone who is using opioids and potentially is overusing or is illegally using, talk to them about this program. If you're talking to coworkers and they happen to mention that their child or their cousin or their somebody, their friend, their neighbor is experiencing issues, talk about this program so that they can come in and receive services. Be available to people who are nervous to come in alone. So you're talking to your neighbor and they are telling you that they're experiencing issues, and you tell them about this program and they say, oh yeah, but I don't know if I want to go. Tell them, I'll go with you. I'll sit with you. It's 2 hours, but I'm willing to come in and do that. Share this information with businesses that you go to. Share with doctors' offices, EMTs, ER personnel, anyone and everyone who might come into contact with individuals in need of this program. So, to conclude this presentation, opioid addiction and overdose has become a very serious issue. In 2019, in Nebraska, over 70% of all the deaths involved an opioid. And out of that 70%, 72.9% of those deaths involved a synthetic opioid like fentanyl. Fentanyl is now being added into many drugs, including marijuana. It's getting mixed in because it's very addictive, but it's also deadly and can be deadly. Nationwide, 115 people die every single day from an opioid overdose. So, just some knowledge about this program, about opioid addiction, opioid overdose, and what you can do as a member of the community to help. One of those things is to tell people about this program at Lutheran Family Services. For a better understanding of medication-assisted treatment and opioid use disorder, I would recommend that you check out the video on YouTube that I have listed here. If you go to this link and click on it, it should take you to the video. It's about 23.5 minutes long, but it is well worth the time to watch. Thank you so much, and if you have any questions, please reach out to me at Mary.Rittenberg, and that's Rittenburg at one spelled out ONELFS.org. Thanks so much for your time and attention, and have a great day.